Since 2010, there have been numerous articles on alcohologist.com challenging the junk science people were willing to believe regarding the health benefits related to alcohol use. There are zero health benefits, not from wine, not from moderate drinking. There's no evidence that drinking a toxin is going to make you prettier, healthier, funnier, smarter, immune to disease, have a better sex life, or extend your years on this planet. Even the notion that alcohol improves quality of life isn't realistic. 4 things to remember when reading a study promoting alcohol. Number 1, many of these studies compare moderate drinkers with current abstainers. These abstainers could be people who had, for example, stopped drinking because of poor health, the disease of alcoholism, legal issues, or just plain common sense. When a 2016 study from the University of Victoria adjusted for these sorts of abstainer biases, only 13 of the 87 studies didn't bias the abstainer comparison group, and none of those 13 showed any health benefit associated with moderate alcohol use anyway. Number 2, in 2013, the journal Addiction ran a critical analysis of observational studies versus evidence-based ones, and it concluded that for almost all diseases, we do not know of any plausible biological mechanism explaining a preventive role for alcohol. Alcohol's possible ability to prevent diseases should probably not be considered as an established fact. The absence of definite knowledge leaves plenty of room for wishful thinking, which we observe frequently on this topic. That's their quote, not mine. Number 3, common sense does not support the notion that a drug that causes a disease can also help prevent the same disease. Alcohol increases blood pressure in the lab and is claimed to protect the heart in pro-alcohol studies. Alcohol use is a documented carcinogen, but pro-alcohol studies claim some prophylactic effect. Alcohol use visibly shrinks the brain in MRIs and cadaver studies, but pro-alcohol studies claim it helps stave off dementia. 4th, and not the least, is to ask, does this study pass the smell test? What would cause a reputable physician or scientist to expend the time and resources and risk reputation to look for a health benefit of consuming a toxin and known carcinogen? Health or otherwise, what causes problems is one.